Happy Tuesday. Time for Tidbit Tuesdays. So something I've been dealing with a lot lately is people who are leaving an employer or retiring early, and now they need to shop for health insurance, and they're getting sticker shock because I had one person that worked for a very large company. Their monthly insurance premium that was taken out of their paycheck was $30 a month. Huge company. So the company was contributing tons of money towards their premium, and they were shocked to learn that they're going to pay at least $300 for coverage. Cobra was $800, so the $300 was better, but it was just crazy. And so, trying to talk people down off that ledge, even before I send quotes, I kind of say, hey, your employer paid a lot of that. So, yeah, well, Cobra's $800. I know, I think we can probably beat that. But let me run some quotes for you and send you those quotes. And then we talk through it, and, they realize it is what it is. And, we just kind of roll with that. The other thing people don't plan for is early retirement. So I've dealt with a lot of people that retire early at 62, 62 and a half. And again, they're entitled to do Cobra usually, but then Cobra they think is expensive, which most times it is, but occasionally it's not. And again, when I'm quoting a 62-year-old health insurance, it's going to be at least $700 a month, at least. Now, if they qualify for tax credits, sometimes we can get that down because now they're not working, so their income is going to be lower. In those cases, sometimes that does work out for them. But again, this is something that people don't think about planning for when they're retiring early. They think about a whole bunch of other things, but not about their health insurance. The last thing I see when people get sticker shock is when they're moving from another state to Texas. Insurance is different from state to state, and if you've moved from a state that had their own exchange or had their own plans like California, Colorado, New York, you're in for a very big surprise there as well, because Texas plans are different. Texas doesn't have those same plans, and Texas didn't accept the Medicaid expansion. So people who qualified for Medicaid in some of these other states will not qualify here. I've had people that have like almost no income and then are shocked to know that they're going to have to pay full price for their health insurance. So see, these are just things that people need to take into consideration to help avoid the sticker shock. Knowing what your employer pays on your premium can be helpful for you to know that, if you leave that job, you're looking at paying the employer cost too, because that is the full cost of the premium. So these are things to take into consideration, how you're going to be covered under health care. And so I help you navigate that the best I can, but when people just don't understand, it's just going to take a little bit of time to educate them and help them walk through it and get them off the ledge. Until next week, peace out.